Lizzy. I'm going to be your nurse and I'm going to be doing a pulmonary assessment on you today. So, first things first, I'm going to lift up your tank top and inspect your chest for symmetric and unlabored breathing, which it appears you have, which is a good and normal finding. Next, I'm going to palpate for respiratory expansion, and it appears to be symmetric, which is also a good sign. Next, I'm going to percuss in all 9 areas. So, I'm going to this here. And then if you could sit up for me. And there are 6 spots on the back. And as I do this, I'm listening to make sure that they are symmetric and also hollow sounding, because the lungs should be full of air. And then there's one more spot on the right lobe. And it sounds hollow and symmetric, which is a normal finding. Next, I'm going to auscultate in all 9 areas. Breathe. And all respiration sounds symmetric and unlabored and clear, which are good signs. So next I'm going to assess for midas, which is vibration. So if I could have you say 99 for me. 99, 99, 99. And again. 99, 99, 99. Can I feel these vibrations are symmetric, which is a good sign? So next we're going to do a cardiac assessment. So if I could have you lie back down. First thing I'm going to do is assess the precordium for obvious lifts, heaves, and thrills, and I don't see any, which is a good sign. I don't see any obvious cardiac motion like a coiled chest, which is also a good sign. Next, I'm going to palpate the apical pulse, which I feel, and I'm going to auscultate the aortic, pulmonic, tricuspid, and bicuspid. So aortic, pulmonic, tricuspid, and mitral valve. And I'm going to listen first with the diaphragm of my stethoscope, and I'm listening for S1 and S2, and then with the bell, and I don't want to hear S3 and S4. So. Okay, and everything sounded normal. Next I'm going to assess for jugular venous distension, which I do not see, which is a good sign. And then I feel for venous pulsation, which I do feel. Next I'm going to feel for your carotid pulses one at a time. So there's one there, and one there. And when I listen, I don't want to hear any breathes. And I don't hear any bruise, which is a good sign. Next, I'm going to assess your feet for pedal edema. Just take off your shoes. Thank you. So, I don't see any bilateral pedal edema, which is a good sign. I can feel your dorsal tibialis, or your post-tibialis post, and your dorsal pedal pulse, which are all very good signs. Do you have any questions? No. Okay, thank you. Hi Mary, my name's Lizzy and I'm going to be doing a full abdominal assessment on you today. Is that okay?
Yeah.
Okay, so the first thing I'm going to do is inspect her abdomen for any asymmetry, mass, or abnormalities. I'm also going to look at the contour, and as I just visually inspect, everything looks normal. The next thing I'm going to do is auscultate for bowel sounds in all 4 quadrants, and then listen to your renal artery to see if you have any bruise. Okay. So the 4 bowel sounds can be divided into the left upper quadrant, right upper quadrant, left lower quadrant, and right lower quadrant. So. Okay, so it sounds like you have vowel sounds in all 4 quadrants, which is a good indication that your bowel's working the way it should and you don't have any obstructions. I also don't hear any bruits in your renal artery, which is a good sign that it's working the way it should. The next thing I'm going to do is percuss all 4 quadrants. And when I percuss, I expect the liver to be pretty dense and the bowels and the stomach to have more air in them. Maybe not necessarily with the stomach, depending on when she last ate and what she ate. So, and I hear her liver is more dense than your stomach, which is a good sign. Sounds like your bowels have some air in there, in them at the bottom. So, the next thing I'm going to do is palpate lightly first. So, no pain or tenderness as I do this, which is a good sign. Next I'm going to palpate more deeply. The first thing I'm going to palpate for is the edge of the liver. So. Okay, and I feel her liver. It's a little bit more dense, which is how I know I'm palpating the liver. Next I'm going to palpate for the spleen. Next I'm going to palpate for the stomach. Okay, and then I'm going to assess for pyelonephritis. So I'm going to have Mary sit up. And the kidneys are located retroperitoneally, and I'm just going to take my fist and lightly tap at it. Mary, do you feel any pain or tenderness? No. Okay, that's a good sign then. Do you have any questions for me?
No, not right now.
Okay. Hi Mary, my name's Lizzy. I'm going to be your nurse today and I'm going to be doing a neuro assessment. So the first thing I'm going to do is assess your visual acuity, which tests your cranial nerve 2. Would you mind reading the bottom line for me?
3891362.
And that's correct. Your vision is 20/20 and I know your cranial nerve 2 is working. The next thing I'm going to do is assess your intraocular muscles, which will be testing cranial nerves 3, 4, and 6. So if you could just follow your eyes with me. And because they work, I know, or because she was able to follow directions, I know your cranial nerve 3, 4, and 6 are working. Next I'm going to assess your pupillary response to light. So, because your pupils restrict in response to light, I know that your cranial nerves 2 and 3 are working. Next I'm going to inspect your eyes and periorbital area, so if you could look down for me, and then if you could look up for me, and everything looks normal. Next I'm going to look inside your mouth, and can you say ah for me? I see bilateral contraction of the uvula. I don't see any sensitivities with your teeth, which are all normal findings, and I know that cranial nerves 9, 10, and 12 are working. Next thing I'm going to assess your cranial nerve 11, if you could shrug your shoulders, and because she can do that against resistance, I know cranial nerve 11 is working. Next I'm going to assess for sharp and dull vibrations in all 4 extremities, so this is dull, this is sharp, if you close your eyes.
So sharp, dull, sharp, dull, dull, sharp, dull, sharp.
And that's correct. Next I'm going to assess for vibration in all 4, so can you tell me when it stops?
Stopped, 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 stopped.
And those are normal findings. She was correct. Next I'm going to assess do a Babinski test, which was, I'm looking for toes curling, and because they do, I know that these are normal findings. Next, can you touch your fingers to your thumb for me? Now touch your nose, touch my finger, nose, finger. She's able to perform these, follow directions, these are normal findings. Next I'm going to have you walk to the door for me, and then walk back heel toe.
Walk to the door.
And I'm looking at her gait, which is normal. She's able to perform this test, which is normal. Next I'm going to have you stand with your feet together, eyes closed, put your arms out. Because she doesn't fall over, which is the Romberg's test, and she doesn't have any protonate or drift, I know that these are normal findings, which means congratulations, Mary, your neurosystem seems to be fully intact and functioning.
Thank you. That's good news.
Hi Mary, my name's Lizzy. I'm going to be your nurse today, and I'm going to be doing a musculoskeletal assessment. So first I'm going to assess the range of motion in your neck. Can you touch your chin to your chest? Look up towards the ceiling, like this, that way. Shake your head no. Excellent. It looks like she has great range of motion. Next I'm going to assess the range of motion in your shoulders. So if you could make a full circle one way and then the other. And I feel some crunching and some cracking, which probably means you're an athlete and you're very active. Is that true?
Yeah.
Okay, let me see the other one. And I hear both crunching and popping again. Next, I'm going to assess the range of motion in your elbow. So I'm going to passively move her arm like that, and I feel her elbow moving. Same here. Next, I'm going to assess her bicep strength. So if you could pull your arm towards, and now push your arm outward. That's assessing her triceps. I'm going to do the same here. Pull your arm towards you for biceps and against me for triceps. And her strength seems to be bilateral, and she has good strength. So next I'm going to ask you to grab my fingers and squeeze and pull as hard as you can. And it seems like she has good strength and it's bilateral. Next I'm going to assess your hips. So if I could have you lie down. I'm going to place my hand on her hip and assess for range of motion. So first I'm going to abduct her hip and then adduct. Then I'm going to do the same on the other side. I'm feeling for range of motion adduct and that's abduct and adduct. Okay, next I'm going to assess the range of motion in her knees. So she's not moving, I'm just going to move her knee passively, feeling the joint. And everything looks good. Next I'm going to assess her hamstrings by asking her, here, if you could keep your leg down, to straighten your leg, again, it's me, and then to pull your knee towards your chest, and she's pushing against me. Then I'm going to ask her to do the same thing, straighten your leg, and then push, okay, and her strength seems to be bilateral and very strong. So that was her quadriceps and her hamstrings. Next, I'm going to assess her plantar flexion. If I could have you sit up just so you'll be in the camera. I'm going to ask you to push your toes out against me, and then pull your toes up against me, and everything seems normal. Did you have any pain or discomfort?
No, no questions.
Okay, everything seems normal. Congratulations. Can I answer any questions?
Okay,
thank you.